answer that question, I would say that my interest in oculoplasty arose after working with some stalwarts in oculoplasty. While I was doing my post-graduation, I had the good fortune to work with people like Dr. A.K. Grover and Dr. Anita Sethi, who were doing some fantastic work in oculoplasty. And so seeing them, assisting them in their cases kind of ignited that interest in me also. And so for me, the natural next step was to get further exclusive training in oculoplasty. And for that, I tried to find out which was the best place at that point of time, and it was LVPEI Eye Institute, where under Dr. Santosh Honawat's mentorship. So I think the credit goes to my mentors, who from one stage to another led me through this interesting journey of oculoplasty. My success mantra, I would say that it applies to any field, anything that one is pursuing, whether it is oculoplasty, cornea, retina, or any other branch, or any other thing that one is pursuing in life. I think there are some common things that I find important. So number one is, I think the most important thing is a very solid basic training, something which cannot be substituted for. So in the initial phase of your training, from wherever you do it, it has to be really good, and that actually sets the foundation for your future growth and your future interest. So if your basic training is good, then you just have to build upon that. So that acts like a good foundation. So if you are going to construct a building on it tomorrow, it's very important that the basic foundation that is laid is solid and strong, and then subsequently you just have to build upon it step by step. The other thing that I would like to stress upon is stick to your ethics, be ethical and be honest in your work, in your practice, and that may lead to a little slower growth, but it is always important, will give you a lot more satisfaction. And number three is, particularly for those who are interested in pursuing oculoplasty, I would tell them to have a lot of patience while they are working on it, because it's a very niche branch, and so if you are going to pursue this branch, you also need to have a lot of patience. The results will show. If you are doing good work, the results will show, and so you just have to keep doing good work consistently with a lot of patience, and definitely I think for whosoever is pursuing this branch, it'll be good. Everyday motivation, if I have to talk about my subject, is the vast variety of cases that we get in oculoplasty, where there is such a vast range of entities that we are dealing with, whether it's an eyelid problem or an orbital issue or a socket related issue or a lacrimal system related. So there's a lot of range that one has to deal with. There's a lot of variety where each patient is so different from the previous one, and it helps you to apply your brain, it keeps your mind active, and the reconstructions you have to plan, you have to really be focused, and while you're operating, when you're so focused in your surgical area, so that gives you a different high. So I think so the fact that there is so much of variety which never lets you get bored or never lets the work become monotonous, I think that aspect is really important, and that gives me the high or the motivation to go to work the next day. Some of the key challenges that I recall when I began this path were, to begin with, even after doing a post-graduation and even after working with some great oculoplasty specialists, when I went for my fellowship to LVPEI, a large part of my fellowship had to deal with oncology, and that oncology subject was relatively new. And so that was the first challenge, because even after you do your residency. And now things have changed obviously, but then in those days, even after you've done your residency or everything, still our exposure to oncology was very limited. And so that was the first challenge I faced, and it felt like, you know, something overwhelming as to in the oncology OPDs as to what you're dealing with. It was difficult to grasp initially, but then over a period of time and with excellent teachers around, the path became easy. The next challenge came after fellowship, when you hit the road and you are out there in the real world. That's the next challenge that I think everybody faces when fresh out of fellowship. And in my situation, it was particularly a little more challenging because I was going to kind of start a new specialty in a hospital where this branch did not exist to that extent earlier. So yeah, that was the second challenge, and the cases initially were hard and difficult to come by. And there were less cases. Obviously there were financial challenges also. But as I said, if you have interest in something and you keep at it, keep doing your good work, and you are persistent, then obviously the results will show, and they did show with time. But it takes time. So my advice for anybody who wishes to pursue this branch would be, I think the first thing that I would tell anybody who's graduating or doing his post-graduation and wants to do some fellowship is that first understand yourself. Try to look within yourself, understand what you are, who you are, and then choose your subject according to what appeals to you, what appeals to your mind and what appeals to your soul, rather than just looking around at others, who is doing what and who's earning how much. Yeah, there will always be differences. Somebody would be earning more than you, somebody would be earning less than you. So that should not be the deciding criteria. Of course, we need to be practical, but I think any branch that you choose, that part usually gets covered up. What is important is that you should be truthful to yourself and be very, very honest with yourself as to what appeals to you and what you would like to do, because it will be something that you would be doing for the rest of your life. So if you choose a subject which you've just chosen out of compulsion or out of looking at others, then you may get to regret it later. You don't want to do that, or you may not get that kind of kick or that kind of enjoyment from it. So whatever subject you choose, it should be something that you really enjoy doing on a daily basis. That enjoyment part, that being attracted to that work and having fun in that work every day, is something which is very important whenever you choose a specialty. Thank you.